Some of us, this COVID is a curse, we don't like it. But one of the major lessons or one of the outcomes, which is positive for us, is the awareness on hand washing with soap. That has been, brought on to the people. So everywhere we go now, you see people with hand washing facilities, people washing their hands, and you see people even innovating new technology to support. And I think that is good. But then it didn't have to take us a COVID-19 outbreak before we go that way.
You are a WASH consultant, and you have been with especially UNICEF as they went about these campaigns for the protocols. What have we done differently during this time that we are seeing a massive awareness for people to wash their hands?
Yeah, over the years, as I said, it has been part of an integrated water, sanitation and hygiene approach. So it hasn't been that aggressive. But then this one is an outbreak. Everybody is panicking. Everybody is afraid of infection. And all of a sudden, you see all the mass media outlets also supporting the campaign. You see civil society organizations, you see churches and other groups, everybody joining the campaign. And I'm so happy to say that most of the media institutions, in the morning, 6 o'clock news, they want to even announce some of these protocols first before they go ahead with their news. And these have been the additional dimensions. And I wish that spirit is sustained, because we have been talking about that, we have been clamoring for this, we have been working with especially the media to at least 1 minute a day or a second a day just say something about sanitation and hygiene and hand washing. That has not been forthcoming, but I think this has aroused that spirit, and now we have now all come to the realization that if I don't wash my hand, you can also be at risk. So that spirit should be sustained. Yeah.
Mr. Akwa, do you think we've done enough?
Well, I might say partially we've done something. If I can rate it, we've done say 45%.
Why would you rate it like that?
Oh, well, we should do more education. The education is not going to the grassroots. The education itself. The hygiene officers who are supposed to do the education and enforcement are not there, are not resourced to do those works. So if enforcement, education goes with enforcement. So if we educate and we see recalcitrant ones, there must be enforcement.
We'll be coming into that bit more shortly, but you are an environmental health officer. Tell us, who is an environmental health officer? Well,
environmental health officer, first of all, let me greet all environmental health officers in the country, especially Chief Superintendent Jerome of Police Headquarters. Environmental health officer is a person who has attended schools of hygiene, any of the 3 schools of hygiene, and registered with the Allied Health Council to have a license to practice. Is an environmental health officer.
And what has been your duty, if you can walk us through the duties of an environmental health officer?
Well, basically, environmental health officer is a hygiene officer. And we do more of inspection into environmental health and sanitation or public health inspection. We do, what do you call it, house to house. Let me see, domiciliary inspection. Domiciliary inspection, we talk of house to house. We come to school inspection. We come to market inspection. We come to we do a lot of inspection. Our work basically is inspection. Yes. So environmental health officer has multi-facets. We cut across all areas. Wherever human beings and animal lives, environmental health officer must be there to perform his or his duty in education and enforcement of public health laws.
Okay. Ms. Akwa, I will be coming to you again for you to walk us through the legal duties of an environmental health worker. But let me also tell viewers that we thank you once again for joining us on WASH Hour. You can join us by WhatsApp, and the number is 0260-969-160. You can keep your thoughts and your comments coming in. We will be legal duties of an environmental health officer.
As you can see, there are so many books here. They are all legal books. They are laws. 2016 Act 8936. I quote. It said, health officers of the District Assembly under the Public Health Act 2012, Act 851, shall be an officer of the District Assembly of that area to give effect to and enforce bylaws related to public health made by the District Assembly. When we say Public Health Act, this is the act. This is the Public Health Act 2012. And it says that a person who discharges the duties of a medical officer or sanitary inspector. In the colonial era, we were called sanitary inspector. Our names keep changing. Nuisance officer, sanitary inspector, now environmental health officer.
And we have others like the Nsama and
tankers. They are all the same, and we perform the same duty. Now, if you look at the Public Health Act 2012, it has outlined a lot of works, duties that environmental health officers must. Section 3 of the Public Health Act, it says, it has given an environmental health officer and other people mandate to stop vehicles. It says, Section 3 of the Public Health Act 2012, Act 851, I quote, stopping of vehicles. Section 3, Clause 1, a medical officer, a veterinary officer, an environmental health officer, a police officer, or any other person designated by the minister may, for the purpose of medical examination, A, stop a vehicle traveling in or suspected to be traveling in or traveling to or from an infected area, and B, detain any of the persons traveling or being conveyed in or on the vehicle. Subsection 2 says, a person suffering or suspected to be suffering from a communicable disease or a corpse or an article suspected to be capable of spreading infection may be removed from the vehicle and dealt with as prescribed by the regulations made by the minister. And the last one, that's clause 3, says a driver or a vehicle who refuses or fails to stop when asked to do so by any of the persons mentioned in subsection 1 commit an offense and is liable on a summary conviction to a fine of not more than 50 penalty units or to a term of imprisonment not more than 3 months or to both.
Right.
This section has given environmental health officers the power to arrest and detain. We arrest. During the enforcement, we arrest. If an environmental health officer comes into your house, your company, or wherever you are, identify some nuisances around, and issue you an abatement notice, indirectly, you have been arrested.
You know, in times past, you know, you were very significant. When we say in someone or tankers is coming, everybody is scrambling around to make sure that their environment is neat. Is that the same way we are seeing it now?
Well, it's not the same.
Why is that?
It has deteriorated.
Why is that?
The problem started in 1994 and 2017. Let me start from 1994. Environmental health officers are health workers. When we classify health workers in the country, environmental health officers are health workers. In 1994, His Excellency, the ex-President Rawlings, made a call that environmental health officers must be moved from the Ministry of Health to the Ministry of Local Government.
Okay.
So there is a report, a committee sat on it and did the transfer. This is a 68-page document of the report. So it says that that's the report on the committee, report of the committee on the transfer of environmental health division from the Ministry of Health to the Ministry of Local Government.
Specific reason for that?
There wasn't any specific reason attached to it. What we came to hear at that time, I was in the maybe primary or SS. Yes, what we came to hear was that government at that time wanted the enforcement to go down to the communities. Decentralization, decentralize our duties in the community. At that time, the local governments were having some environmental health officers. Those who were good, especially the laborers at that time, were sponsored to schools of hygiene to come and study the environmental health. When they complete the school, they are brought back to serve at the Ministry of Local Government. Whereas those from the O-level and others who apply themselves to the schools of hygiene are sent to Ministry of Health to practice environmental health. Ghana Health Service was established in, I think, 1996. So at that time, we were called Environmental Health Division. It was a division under the Ministry of Health, and we were brought back. And our transfer caused all this sanitation, environmental health and sanitation problem currently in Ghana. We were just transferred. The personnel were only transferred. That's the environmental health office only. Our budgets, our equipment, our laborers that we work with, and everything were left at the Ministry of Health. So we went to Ministry of Local Government without any equipment.
So you are saying that the transfer is what is accounting for the problems we have in the sector now?
Exactly. Because we were having structures, well-designed structures at the Ministry of Health. The transfer took only the personnel without the structures. So at the Ministry of Local Government, the structures are not there.
Let me bring in Mr. Dai. You are on the field. As you go on the field doing your work, all these concerns he's raising, do you see it on the field?
I should say yes. I don't know definitely where he's saying there was no reason, but definitely there would be a reason for the government to move a whole unit from one ministry to the other. Maybe it's not written, but I don't know. But then yes, partially what he's saying is reflecting on the ground, because health, I think the most prudent way to manage health generally is to prevent people from getting sick.
Of course.
Before they even get sick, and they go and prioritize the work of the doctor or the nurse or even hospitals and so on. But because that particular unit, or at the moment is a directorate, has not been highlighted in government priorities over the years, it is reflecting on the ground because their work is not prioritized at all. They know the work, they have been trained, they can talk about environmental health issues, they can enforce, they can sensitize, and I would say no NGO can operate very effectively on the ground in communities without working with the district level environmental health personnel. But most of the time they have virtually no budget. Some of them don't have vehicles to work with. Motorbikes that they take to go to the remote communities and so on, many of them they don't have. When they are even given by some NGOs and other donors, maintenance is an issue. Some of them fueling, just buying fuel so that the staff can go to the communities to work, it's an issue. I've worked with a lot of them from Upper West, Upper East, Northern, Volta, Central regions. They all have the same problem. If you take away the influence of some major development partners, let me say like World Bank, UNICEF, and other international NGOs like World Vision, Global Communities, when you take them out and you want to rely on government support alone, that department actually can, they will be there, but they will have nothing to work with. Because over there, maybe y'all can explain the structure very well. I don't know who they report to. In some reports, they are supposed to be reporting to the district director of health. On the other hand, they are also staff of the Office of the Head of Local Government Studies, Local Government Service. Again, we also have a dedicated sector ministry which also has the environmental health and sanitation unit. So some of us are even confused that where do these people belong to, because the Ministry of Sanitation has no control over them, right? Meanwhile, they are the ones to provide the policies to guide implementation there. You go there, they are under different ministries. So, well, I don't know the impact of whether they belong to local government or Ministry of Sanitation or Ministry of Health. But what I see is that the environmental health units or the directors have not received government priority over so many years, at least ever since I entered the sector somewhere in 2002. That department or that unit has never had the priority that their counterparts at the Ministry of Health have been enjoying. And you and we can testify to this. We have various different governments and what But can you imagine that between 2012 or was it 2011 and 2017, environmental health officers were not recruited at all. But about 5 years freeze.
We hosted the Minister for Sanitation, Madam Cecilia Dapa, last week, and she was saying government has given clearance for about 1,000 or so of EHOs. Is that not the case?
Yes, government has given clearance to 1,174.
Right.
And these graduates sat in the house. Some 31 were not posted. I think the system did not capture them. Starting from 2010 to 2015 up to date. 2010 to date. So some have stayed in the house for 10 years. And others too have stayed in the house for 5 years. And this has keep on repeating itself. The graduates complete school, first year, second year, third year, when there is an election year. So Accra School of Hygiene, there's 3 schools of hygiene. We have one in Ho, one in Tamale, and one in Accra, Kolebu. These 3 schools of hygiene. The intake, the whole year, won't be less than 300. But students or graduates complete school, and they are left unposted for 5 good years. So schools of hygiene graduates are posted every election year. That has been the trend for the past 15 years, which is wrong.
Mr. Kwa, I would come back to the transfer, you moving from one unit to the other. I would want to find out, will that even affect the core duties of an environmental health officer? I mean, moving from one unit to the other. But let me just tell viewers that they are watching Wash R. They can join us on WhatsApp 055-744-6429. We want to hear your thoughts about the discussion we are having. We are also on Twitter at GBC Ghana and on Facebook at Ghana Broadcasting Corporation. Mr. Kwa?
Accra was established in 1925 at the secured of hygiene. And in 2017, when schools of hygiene, which were Ministry of Sanitation, our challenge, everything that starts or affect the school, happens in the school, it affects the field office, vice versa. Now, the schools of hygiene, over the years, the Ministry of Health has been taking care of the schools from training to practice. In 1994, before 1994, we were under the Ministry of Health. The school, all the admission are being done by the Ministry of Health currently. But the Ministry of Sanitation says it's in charge.
So that is where the disconnect is?
Yes. And then when it comes to we, the practitioners, before 1994, we were under the Ministry of Health. And when I attended school in 2004, we were under the Ministry of Health. It's just 2017 when the Ministry of Sanitation was established. That's where they moved the schools of hygiene. Our problem is that under the Ministry of Health, they have over 80 health training institutions, and they have rest of the school. But under the Ministry of Sanitation, there isn't even a front desk unit for the school. So when the schools have any problem, they go to the ministry, and they don't even know who to talk to.
There seems to be no implementing agencies under the Ministry of Sanitation.
You are right. Yeah, the Ministry of Sanitation and Water Resources, urban water, and then Community Water and Sanitation Agency is there for rural water supply. Then we have the Water Resources Commission for water resources management.
Right.
So it is the MMDAs, the district assemblies, the metro, municipal and district assemblies. It is which has been mandated to be in charge of sanitation in the country. When it goes to the ground, apart from developing the policies and major strategies, when it goes to the ground, it is a different ministry, because the MMDAs are under the Ministry of Local Government and Rural Resources, Rural Development.
Yeah.
So that there is a gap there, because you develop your policies, you don't have any link down there, because the staff there do not report to the Minister of Sanitation. they report to the Minister of Local Government, or the Office of the Head of, has led some of us calling for a dedicated authority and water resources. When you look at the Ministry of Health, they have the Ghana Health Service, they have the ambulance service, they have the National Health Insurance, they have, I think, about 4 different agencies and authorities under them. You go to Ministry of Education, at least the Ghana Education Service is there. There are so many ministries of with different agencies, but sanitation is such an important sector that seems to be in a mix, because even the staff to be at the front line of sanitation and hygiene, they are not sure where they belong to. I mean, based on what they have been talking about, they are not sure whether they have to belong to the Ministry of Local Government or under sanitation. And then we don't have a dedicated agency to work to support the Ministry of Sanitation. So yes, over the past 2 or 3 years, we have been crying for the agency. And I think last year at the Morley Conference Series in November, we got some major promise from the Vice President that they are working on it. And I remember recently, just about 2 weeks ago, the ministry has actually sent letters around soliciting CSO inputs for the so we are happy that the NSA is coming about. Yeah.
But instead of the NSA, the EHOs are rather calling for an environmental health authority.
Yes.
How different is that from the NSA?
Yes, sanitation authority. When we say sanitation, basically it's water and toilet.
Okay.
Basically, sanitation means water and toilet. But when we say environmental health, it is the natural and the built environment, whereas sanitation is part of it. So we are calling for environmental health authority, not sanitation authority.
So it's just a name? Or
the name, technically, we are technical officers. So when you are using the word, the technicality of the name must come.
Will the core functions not be the same?
No, it will be limited. If you look at the Ministry of Sanitation and Water Resources, I'm not sure they are in charge of the waste contract of Zoom Lion & Co. They are limited to water and CLTS and others. But when it comes to the contract of Zoom Lion & Co., it's been done by the Ministry of Local Government and Rural Development. So
I see Mr. Dai wants to make.
Yeah. Well, I support in a way, in parts, what he's talking about, the name, because it is true. Sanitation, as a technical term, is limited to more or less like human waste.
Okay.
That's the liquid waste aspect. But then generally, what people understand by sanitation also includes solid waste management and everything. So that is the confusion. But I think I'm not very sure about which ministry is in charge of solid waste, because it appears when it comes to contracting is somebody else. But then when there's public outreach, then it's the Ministry of Sanitation. That one to maybe if Akwa can help, or the ministry can come out to tell us who is in charge, because some of us know that sanitation is under the Ministry of Sanitation and waste management. They are all under the Ministry of Sanitation and Water Resources. Whoever gives contracts, I'm not very much aware of that. But I think, well, if the name can be amended, it will not spoil anything, so that people's issues can be accommodated, because environmental health, of course, is wider than sanitation. But I think that the document they are producing encompasses everything under environmental health. I don't think it will leave out solid waste management, or it will leave out hygiene or hand washing. They are all part of it.
Right.
But and those of us who have been crying for that authority, that is what we mean. We are not asking for an authority which will be only in charge of let's say open defecation or household toilet, but sanitation has a connotation, and that how people understand it, it includes everything that environmental health people are working for.
Mr. Akwa, I do understand your concern. Go away from the core duties that we know of the environmental health officers, because back then we knew that you had to go to homes, from home to home. Now you pass through streets and people's yards are overgrown. What is happening?
Yes, I will quote a law, but let me quote a law here. Section 296 of the Criminal Offences Act. laws, environmental health officers have been given a whole lot of laws. All these things, our mandates are in. So when I hear some Ghanaians calling for MMDAs establishing or gazetting bylaws, some of us, the professionals, sometimes laugh.
We have the laws.
We have the laws. We have the national laws. We have the national laws. Plenty. All these things are there.
So why are we not using them?
Enforcement has been the problem. One, where environmental health officers are currently are not being recognized. Under the Ministry of Health, we work with the medical officers, we work with the nurses, we work with, so we are public health law enforcement agents. Public health law enforcement agents. So we are the only in the country.
We do understand that. But I'm wondering if there ever is going to be a day when I'll hear a knock on my gate or my door, I'll open it and it's an environmental health officer coming to check.
We are there. We are working day and night. The only health worker who works more than 8 hours as against the Labor Act is environmental health officer. Even holidays and weekends. We are there. We are working day and night. But our staff are limited. Look at the graduates. They complete school for 5 good years before they are posted. And you go to some of the MMDs, the Metropolitan Municipal and District Assemblies, and you will find only 5. In the Municipal Assembly, you can find 5 environmental health officers in the Municipal Assembly. What can they do? And they are supposed to do a whole lot of inspection, health education, and enforcement of public health laws. But where are they?
The picture looks indeed
our issue is that if you look at all professionals in the country here, let's take teachers. Right from training to practice, they are under one ministry.
Okay.
So Ghana, the colleges of teacher training colleges or colleges of education are under the Ghana Education Service Ministry of Education.
Okay.
When it comes to the doctors, the nurses and go, they are under the Ministry of Health, Ghana Health Service. But when it comes to environmental health, we are under Ministry of Sanitation, who is in charge of the school.
All right.
The tutors who trains these graduates are under the Ministry of Health.
Mr. Kwa, you have to hold your thoughts there for me. If you just join us, you are watching Wash Hour. We'll be back shortly. Please stay with us.
After you eat, brother, wash your hands with soap. After you boo-boo, before you catch strain diseases, diarrhea, polio, malaise, cholera, sewangeia, beka kaima, unyai open defecation. Cleanliness is next to godliness, yeah. Fale, 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 fale. Cleanliness is next to godliness, yeah. Don't forget to wash your hands before and after you eat. Brother, wash your hands with soap. After you boo-boo, before you catch strain diseases, diarrhea, polio, malaise, cholera, sewangeia, beka kaima, unyai open defecation. Cleanliness is next to godliness, yeah.
Welcome back, and it is still Wash Hour live on GBC News. We are here with environmental health officers and a WASH consultant. We are delving into the issue of environmental health officers in this COVID-19 pandemic and their role against the fight. Mr. Kwa, before we went for break, you were talking about the sanitation situation.
What I was saying is that all professionals in the country have one ministry that trains them, and then they regulate their practicing. The teachers are under the Ghana Education Service, and then the Ministry of Education.
Right.
If you talk to the nurses and the doctors, they are under Ministry of Health, Ghana Health Service. But environmental health officers who were transferred in 1994 to the Ministry of from Ministry of Health to the Ministry of Local Government are under 3 ministries, 2 or 3 ministries. So we don't know who is in charge of us. The schools of hygiene, the 3 schools of hygiene, are under Ministry of Sanitation.
Okay.
Some of them, admissions are done by the Ministry of Health. And we, the practitioners are under the Ministry of Local Government, for that matter, Local Government Service. Currently, at the MMDA level, we report our structure has been disorganized. At the MMDA level, we report to the Regional Environmental Health Officer. And then the Regional Environmental Health Officer is supposed to report to the National Environmental Health Officer, of which we don't have. So we report to the regional officer, and then the report is sent to the local government service. And at the local government service, we don't even have a front desk officer or a director or someone to advise the head of service on environmental health and sanitation issues. So always when our report gets to the local government service, who are our management, the environmental health officers, who we are there, it gets there and then nothing is supposed. There's no technical officer there to receive the report and then advise the Ministry of Local Government to inculcate it in their policies. And secondly, the enforcement aspect. Every law enforcement agent in Ghana here has a uniform. We also arrest. Our arrest is even sharper than, excuse me to say, the police officer. Because somebody must slap you before you go and report at the police station. Your statement will be taken, the complainant statement will be taken, investigation must be entered and other things. But when we enter into your house and issue you a notice to abate a nuisance at a specified time, and you fail to do so, the law says that we should take you to court and prosecute you there. And we are public prosecutors. We stand in for the state. Section 56 of the Criminal and Other Offences Act, that's it. This act has given us the mandate to prosecute, to stand in for the Attorney General and prosecute.
Mr. Akwa, we will delve more into the legal mandate, but we find ourselves in a pandemic situation. What has been your duties towards the hygiene protocols?
Well, for the COVID, it's basically hygiene, enforcement of hygiene protocols.
Right.
And who is a hygiene officer? It's an environmental health officer. We were trained in the schools of hygiene. The 3 schools of hygiene. That's where we were trained. And if governments want to use professionals to enforce hygiene protocols, who should they pick? It's an environmental health officer. But at the onset of the COVID, environmental health officers were sidelined.
How so?
Let me give an example. At the onset of the COVID, the Ghana Health Service called all its district officers into one place at the regional level. The disease control officer, the nutritionist, and co. And they included the environmental health officer because we were part of them before 1994. We were part of them.
So I want to know what has been the duties that you performed during this pandemic.
The COVID.
Yes.
We are into disinfection.
Okay.
We are into the hygiene education, the washing of hands, the nose mask enforcement, the physical distance, the social distancing, and we still perform our duties. The housework, the barrier.
But if you are doing all this, why have there been concerns that you have been sidelined?
The resources, the PPEs, the necessary PPEs that we need to perform our duties effectively are not being given. If you compare the Ghana Health Service staff and the MOH staff, you can see the Ministry of Health, the minister, always announcing they are supplying PPEs to the nurses and co. But environmental health, none. We are buying our own PPE.
Do you have a unified body? Is it unified?
You know, our situation, starting from the school, training to practice, is disorganized. And we are appealing to government to intervene. Other than that, public health situation will still rise. The cases in COVID will still rise. Because those public health enforcement agents who are the environmental health officers, like me sitting here, have no resource. If you go to the assembly, chemicals, under the Ministry of Health, we are having a store that we keep chemicals in. This COVID, like we will have done a lot of research in getting chemicals there as a backup. But if you come to the MMDA, the stores only contains revenue books. The MMDAs are only interested in revenue than public health. So where we have been transferred to is not helping.
Okay.
It's better we get back to the Ministry of Health. That is where we belong. Or the establishment of Environmental Health Authority under the Ministry of Local Government and Rural Development.
Okay.
Because we were having a directorate under the Ministry of Local Government, Ministry of Local Government and Rural Development. It's just 2017 when they established the sanitation ministry that they have moved the directorate there.
Mr. Kwa, I know when somebody dies of the COVID-19, it is the EHOs who goes in to bury the person. Can you walk us through the process? How do you go about it?
Yes. So when we say frontline health workers, let me get so that I'll answer your question. When we say frontline health workers, currently we are in the community spread. Now it's not horizontal, again, community spread. And the only health worker who works in the community is the environmental health officer. We work, our duties are in the communities. We don't work at the hospital. Our work in the communities. And the hospitals are in the communities. So we still go there. They can show some of the inspections that we have done in the hospitals. If your cameras,
yes, we will do that. But I want you to walk us through that process of burial.
Yes. So what happened is that when somebody is infected with a COVID, isolated, quarantined, and co, and during the course of treatment, the person expires, as it's called, dies.
All right.
That's where the environmental health officer takes over.
Comes in.
And we are into fumigation, disinfection. It's a part of our duty. We have been trained in the schools of hygiene with to do that.
Okay.
So the environmental health officer will be called at that time, whilst the person is lying on the bed. The nurses will dress and do whatever is necessary at the hospital. Then the body will be taken to the morgue. That's where environmental health officers come in. We have to disinfect the bed of the hospital. We disinfect everything that that person laid on. If his house is known, we have to move in there to disinfect again. Then the bodies are not supposed to be taken, kept for 72 hours according to WHO. So we have to go in to pick these bodies, invite the family members to just have a look at the.
Does it mean family members have a right to come and look at the body before you bury?
No, for this COVID, any communication, the law says that government take over.
Okay.
So those who are requesting for their dead bodies and co, no.
Oh, but at least to come and have a look.
For them have a look, you can have a look at it. They normally
there's an opportunity for the family to come and look.
Yes, they open the body bag and then you look at it.
Is that
but
safe?
You don't touch it.
It's safe.
You don't touch it. It's safe. You don't touch it.
Okay.
You don't kiss it. It's at a distance.
Okay.
Yes, it's at a distance.
All
so
right.
they are supposed. When you have to know where the body is being buried. But
so does it mean that the family gets to follow the EHOs to where the body is going to be?
Currently, those who have buried Ashanti region and then Accra, who have buried this COVID. What I saw, the family members were not following, but they came to the hospital. I think the procedure, as I'm told, is that when they get the body, the family members come and identify the body.
Okay.
Yes, and then they open the body back, look at the face, give their final, as we call last offices, give their final respect, and then the body is taken away. And our challenge, our major challenge, if you look at what is happening, an environmental health officer dressed in PPE, full PPE, under this hot sun, and is seated at the bucket of a pickup.
Is that what happens now?
Yes. Seated at the back of the pickup with them. Police, the Ghana Police Service have been arresting people who sit at the back of the bucket. Why should a public health law enforcement agent be in a full PP, which is slippery, sit at the back of a pickup, not even on seat? It's very dangerous. So environmental health officers are risking their life in protecting public health and safety in the country, but we are not being recognized and given the needed PPEs and other resources to work and do more in protecting public health and safety.
Mr. Da, you can come in here. We have some comments from our viewers, but you can come in here before we take the comments. I saw that you really wanted to.
Yeah. Because it's very sad, in the way Yao is talking, and these guys play a very important role in the lives of everybody. In fact, they are making sure I don't fall sick in the first place, or I don't contract illnesses, or any infectious disease. But then it appears they are not counted among the health workers in the country anymore, and then they are relegated to the background. Meanwhile, they are supposed to protect us from getting illnesses. And I've always been talking about this, that as a country, if we actually want to solve our health problems, we start from the prevention. Because we are poor, we don't have money. So why don't you stay out of infection before you even think about going to the hospital? But unfortunately, it's like our public policy rather favors the curative side. So we are happy the number of hospitals we built, the number of health work like doctors and nurses that we recruit, and then we are not happy the number of environmental health officers that we have to recruit, such that they can even go 5 to 10 years without employment after graduation.
There is a comment coming in from Mr. Nyame from Abukobi saying, without seeing people punished for Saman sanitation program is meaningless. So we need to see people being punished for their offenses.
Yes.
And how does it go when
Yes. I will speak on Article 191, on the authority of Article 191 of the 1992 Constitution of the Republic of Ghana, and a section of the Labour Act 2003, and state emphatically on record that there are political interferences in our job. So it's making the enforcement of public health law in the country very difficult.
When you say political interference, what do you mean by that?
Where we are, the MMD, the district assemblies that we are, the head is the district chief executive or the municipal chief executive and some assembly members. When you enforce the law, when you go for your inspection, you educate, and then you get some recalcitrant ones who can say on authority that my binder also, my party is in power, so you can't do anything to me in public.
But the law must work.
The law must work. So the environmental health officer will try to enforce the law. What is stated in the Public Health Act, what is stated in the Criminal Offences Act 1960, and co. But along the line, the person will be served to appear before court with a criminal summons. And the day the person, they are even maybe 5, the day these people are supposed to appear in court, the MCE, the district chief executive, will call the officer.
But
drop the case.
Quickly, are the punishments deterring enough?
The punishments are deterring enough.
Okay.
Criminal summons. And looking at you, some people, I won't mention names here, but teachers, other professionals are invited to court. And it's even a disgrace. Standing in the dock, in the full glare of the public, and asking why you didn't sweep your compound with your backyard, dispose of your HE, that's you call it His Excellency, human excrement. It's a disgrace. Enough.
Okay.
The fines are there. The Public Health Act has given a hefty fine.
What's the maximum fine a person can?
Well, it goes beyond, I think, 50 penalty units and go.
Whilst you look for the fine, somebody wants to know why we are not cremating instead of burying the bodies.
No, the Ministry of Health should develop a guideline.
Okay.
For all those things. The Public Health Act has stated, Section 17, that the Ministry of Health, let me see, but I don't. I get the. It says regulations as to disease of communicable nature. Regulations as to diseases of communicable nature. Although the COVID is not rated as communicable, but it has regulations. The Ministry of Health should give a guideline. We are even saying this PPE, I think because of time, there is no guideline to the hand gloves. So people, you see children picking these nose masks on the streets and wearing them. People are disposing them in water bodies. People are telling us to bury. Who?
Right.
People are telling us to bury. Are they safe at all? We are calling on government to develop guidelines for disposal of these PPEs.
Okay, you are calling on government to develop guidelines. Hold on to that thought whilst I invite viewers that now they can call in. We are able to pick their calls now. 055-744-6249. Our viewers can join us now on 055-744-6249. Right, viewers can join us on 0260-969-160, and that is the call line that they can use. 0260-969-160. Mr. Kwam.
Yes. So we are calling. And then secondly, uniforms. If you go to Nigeria, the environmental health officers dress like military officers. Back then, when we were in school, every year the Ministry of Defense bring soldiers, the military officers, to school. In the schools of hygiene. We are supposed to see when an armed robber sees a military officer in uniform, whatever he or she is trying to do will deter him. But environmental health officers, we enter into their houses, they see us in mufti. They don't fear that you shouldn't touch a uniform man. We go to this field and people even slap us.
Mr. Adai, I will come to you to ask you what the way forward should be. But I understand we have Bismarck from Asaman Kese. Bismarck, thank you for joining us on Wash Hour. Hello, Bismarck, are you there?
Well, I'm there. Good evening, madam.
Good evening, and thank you for joining us. What's your comment or question?
This issue is very sad. This school.
Bismarck, if you can lower the volume of your TV set. Okay, I think we lost Bismarck there. Mr. Adai, what is the way forward?
The way forward is we need a national sanitation authority. We have been asking for it to be under the Ministry of Sanitation and Water Resources because we know that ministry has been created to manage sanitation affairs in the country. Well, it may be in any other ministry. All that we are looking for is such an authority which will improve coordination within the sector, whether environmental health officers or anybody, the NGOs, whoever is working within the environmental health sector.
Mr. Adai, you still have to hold your thoughts for me. Eric from Kaswa. Eric, thank you for joining us.
Okay, thank you very much.
Right.
I wanted to make some small contribution for the program. I'm just watching you.
Please go ahead.
Yeah, it's very sad to listen to the man in the environment. We are facing a lot of problems. So we are praying to the government to do something so that they will be helping us. Because it's very dangerous to how he's saying that the workers sit on the pickup and those things. Is that because when the officer sit on the back of the pickup, it's very hard.
And the best way to coordinate is to get a dedicated agency, whether it's an authority or agency.
Are we banking all our hopes on the National Sanitation Authority? Is that going to be, the final straw? That is what is going to help us to solve all the problems we have in the sanitation sector?
No, it won't. The structures must be developed. Build anything, it will collapse. Of health. Then, before 90-hour transfer, those structures were there. Those structures were there. Can be captured because we move house to house, and you are supposed to engage each and everyone in the house.
Okay.
So we can capture those data on our data management templates in our offices.
hold on again. I understand Methuselah from Omanjo is on the line. Hello.
Yeah.
Thank you for joining us.
Please, I'm watching you live on television, GBC.
Thank you.
And then, the man in the quote, he said something about like the officers not being in uniform.
Okay.
In fact, and this country, if you look at certain things in this country, I think our leaders are not doing well. There's something that we need in this country, and they are not doing anything about it. Like example that the man was saying.
So what is your question, Methuselah? That is well noted. Thank you so much for joining us. Yeah. So,
and let me add to this. What I saw again, our members during the COVID barrier were using private hearse in this country.
And that is the same that goes for
the other
people who are also okay.
It's wrong.
Somebody wants to know what happens to a Muslim who dies of COVID-19.
They pass through the same procedure.
72 hours.
The bodies are not supposed, according to WHO, the bodies are not supposed to be kept more than 72 hours.
All right.
Yes.
Okay.
So
yes.
So maybe as a contribution towards the way forward, as we say, and in addition, it's not also always about enforcement. Experience from the field also indicates
a minute again. Francis from Kumasi. Hello. We lost that caller there. You can continue.
So especially in the rural communities, when you go there through the CLTS program that you were talking about, the emphasis is on the sensitization, the education, the rapport that you build with communities and
that
households.
Is the CLTS?
That is the approach it adopts. What I have witnessed is that previously when the emphasis was so much on enforcement and you see the task is in town, then the information will just spread so fast and everybody will quickly sweep. But it was not becoming part of their habit until they hear the next tankers coming. But this time around, when you go there through that approach, you see them like they are now their family members. Somebody can just take a phone and call the tankers to come and inspect.
And by the CLTS, you mean the community-led total sanitation.
I'm not saying we should not prosecute or we should not enforce, but I think there should be a balance: the education, the rapport building, and also the enforcement. Because enforcement, even one would say, it also even creates employment.
Right.
Not that they are forcing us to wear nose mask. Go and see.
We'll be coming to the nose. We'll be coming to the nose mask very soon. But we have Evans from Teshi. Evans, thank you for joining us on Wash Hour.
Okay. Good evening.
What's your question or your comment, Evans?
My comment and to support this issue that my brother is talking about.
Okay.
I'm a fumigation expert. We do fumigation for public health, and anything that we do with public health, they shine these officers with task to move around and work. We work from Accra up to Volta, end of the Volta, from Central up to Western region. We work with these sanitation officers. I don't know how now this epidemic situation has come.
Okay.
I'm giving you the expert that know about this work. They give the work to their own people.
Okay. Evans,
thank you. They give the work to their voice. When the experts are there that know about this pest control fumigation issues.
Right, Evans, thank you. Thank you, Evans. Thank you. Mr. We have just a few minutes left, but let's touch on the nose masks. Are these the approved ones from the FDA?
Yes, this is being produced. We are yet to sell it out.
Okay.
So we went according to the FDA specification. FDA, at the onset of the COVID, FDA released the way and manner nose masks must be produced.
Right.
The FDA, according to the FDA, they said they gave 1 and 2. They said calico, calico, calico. The material should be calico 3 times. So we repeated calico 1, calico 2, calico 3. Or calico, then stiff. The stiff, hard or soft, and then calico. So in all, it needs 3 layers.
Okay.
The stiff is more or less, it looks like the N95 nose mask.
Okay. And which one is the N95? Do you have one here to show our viewers?
I don't have one here.
All right.
The round white nose mask.
All right. Okay.
It's called N95.
Right.
And that's the stiff, normal stiff that we use in sewing our dresses. Yes. So these are we went to sew this. We are yet to take it to FDA for approval. We made the inquiries what we need to bring and co. So we are yet to sew them get approval.
Okay.
Yes. Before you use the nose mask, you must first sprinkle wherever you bought it. Sprinkle water on the inner part. That's the inner part.
Okay.
This is the outer part.
All right.
Sprinkle water on it and put an iron on it. Let it stir. As if you are sterilizing it.
Right.
Because you don't know who so.
And that is before you wear it.
Before you wear it.
Okay.
And after the day's work, here get infected because here is outside.
Right.
So all the aerosol, the droplets falls here. So the moment you get to the house, you sanitize your hands, you remove it, put it there, sprinkle water on it. Because the more
that's
you
the
wash
outer
it,
you are talking about now. Right.
The outer, sprinkle water on it and do the same procedure. Iron it before you put it down. Because the more you wash, you can't wash it every day. The homemade nose mask, FDA said you can wash it about 4 times. But you can prevent the washing by sprinkling water, iron it. So you see that the inner is dirty
before you wash. Okay. All right. Thank you. Thank you. That has been very educative. Thank you for joining us. We have been on Wash Hour. I've been with Mr. Yawakwa Latte, who is the president of the Environmental Health Officers Alliance Ghana, and Mr. Emmanuel Ade, who is a wash consultant. Gentlemen, thank you. I wish we could go on, but our time is up. Thank you, viewers, for joining us on Wash Hour. We'll be back again on Thursday at 4 p.m. same time, same channel. Please keep safe. Enjoy the rest of your day. Thank you for watching.